So this is the anxiety revision screencast. Anxiety is quite a popular topic on the exam and one that you should know inside out. So first of all, there are 4 types of anxiety that you need to know. Just write the 4 names of the 4 types down. So we should have, first of all, we should have trait anxiety and state anxiety, which are opposites. And then we should have also cognitive anxiety and somatic anxiety. So you need to be able to name and describe each of the 4 types, and that could be a question on the exam. Start with trait and state. So trait and state are and you can see that trait anxiety is your natural level of anxiety, hence the name trait. So we should be aware of that, of what that word means. And state anxiety is more in a given situation. So your level of anxiety at a certain time. It's clear that state anxiety is affected by your trait anxiety, so a generally anxious person who has high trait anxiety will have high state anxiety in most situations as well. So state anxiety can be 2 types, which are cognitive and somatic. So cognitive, first of all, is the psychological type of anxiety. So please use that word. Don't use mental or in the brain or anything. Try to use the word psychological is the best word to describe what cognitive anxiety is. So this is things like that you feel that you can't concentrate, that you're not going to do it, that you're going to lose, etc. Things that are going on in your mind. Somatic anxiety are physiological. So this is your worries around your physiological state. So it could be that you're feeling too tense or that you're sweating too much and that's making you anxious. So if we look at what effect anxiety has on our performance, we can look at these 3 graphs, and if we just start with confidence, so you could have a go at sketching out these 3. So if we start with confidence, and so just sketch the graph as to what effect confidence has on performance. So I'm pretty sure that we've got something like that, or some of you might have thought about it a bit more and thought about the concept of overconfidence, but basically what we're saying is that confidence equals an increase in performance. And obviously when we do confidence and self-efficacy, then we talk about that in a bit more detail there. It's worth mentioning confidence though, because confidence is the opposite of cognitive anxiety. So if you now have a go at sketching a cognitive anxiety graph. So as we've said, it's opposite. I think we've hopefully got something that looks opposite and that it looks like something like that. So I think it's obvious that the more worries that we have, the more thoughts that we're not going to do it, that we're going to lose, etc., that you're not good enough, that's going to have a negative effect on how you perform. Just now have a go at the relationship between somatic anxiety and performance. So somatic anxiety is slightly different in that it's thought that we have a slight inverted U relationship between somatic anxiety and performance, that actually some somatic anxiety can be good for us and can affect performance in a positive way, but if that's too much, if the somatic anxiety is too high, then performance suffers. So our next graph looks at the levels of cognitive and somatic anxiety before and during a competition. So this could be a format question where you're required to make two statements for each of the two types of anxiety. So before and during a competition. So if we just have a go at cognitive anxiety to start with, so if you want to try to sketch out what cognitive anxiety looks like before and during. So clearly that cognitive anxiety is a form of state anxiety, so this can alter depending on the type of competition. But what we're saying is that in general that cognitive anxiety can start quite high. So it might even start high here, days before a competition, and we would expect it maybe to rise in the hours before, just before an actual competition. During the competition, again, this depends on what's happening. So a good word that we would use here is that anxiety could fluctuate, so it can go up and down, and that depends on how well we're playing and how confident we are at that moment in time. So performance can have a direct impact on your cognitive anxiety, but the good word is to say that it fluctuates. So whereas what we said over here is that beforehand it's quite high. So now have a look at somatic anxiety. So somatic anxiety doesn't tend to, and we would hope it certainly wouldn't be very high in the days before, so it starts off low, but where it does increase, it increases a lot just before competition. So we can see that this ends up very high just before competition in the hour or the minutes prior to starting the competition. So those butterflies, etc., the feelings of tension, etc., kick in. But then somatic anxiety is thought to decrease really as soon as we start to compete, and it goes away. So it's almost the case of that we want to get the competition underway to get rid of those feelings of nervousness and butterflies in the stomach, etc. So here it lowers quite quickly once competition starts. So in terms of measuring anxiety, there are three main methods that you need to be aware of. If you just write those down now. So hopefully we've got the three as observation, and we've also got biofeedback, and we have questionnaires. If you could just jot down one advantage and one disadvantage of each method. Okay, if we start with observations then, so obviously an observer going to watch a performer in an actual real situation, so therefore we would say that it does have high ecological validity because it's happening out there in the real world and we're seeing their levels of anxiety when they're playing sport basically. So we can look at actual behaviours of the individual and aspects of their performance as well, so we can get a bigger picture of how that anxiety affects the performer. However, it's subjective, and that obviously the observer needs to be well trained and needs to be able to interpret their behaviours in the correct way. So sometimes this may be done differently amongst different observers. It would also be difficult to notice every action and every reaction to every action and lots of their behaviour, and be able to actually see and note down what was going on. It would also be, as it says here, it would also be important to know the performer in terms of whether anything was different, whether they performed differently, whether they behaved differently in a given situation. So you can see that all of this would take a lot of time as well. So secondly, biofeedback gives us data around physiological responses, so we can be hooked up to various machines that record heart rate, blood pressure, sweating, etc., to give us some data around our levels of physiological arousal. So therefore, because we're getting this data, the results can be quite reliable. So what a performer can do with this data is take it and see again if there are any differences from normal. This is clearly difficult to obtain in those real sporting environments, so that we don't really have that high ecological validity that we've just mentioned. And again, the performer, through kind of evaluation apprehension, can feel that they're being assessed and can react slightly differently in that given situation. The other thing with biofeedback is that we would need to then do something with that in order to change it. The last method is questionnaires, and so questionnaires are very easy and cheap to administer, and we can do lots of people at the same time can complete a questionnaire, so we can get large numbers of data as well. However, general problems, disadvantages with questionnaires is that the performers may misinterpret the question, not understand the question properly, or not give an answer that was for the right question. They could also lie or give a socially desirable answer, one that they feel that they should give rather than what is their actual answer. So again, sitting behind a desk doesn't give us that high ecological validity that we would get out in the real world. So you should have in your locker an example of a questionnaire as well that we can use in sport. So there are three main ones. So if you just take one now, I'll write down the name of the questionnaire and a couple of points as to what it measures and how it's administered. So hopefully you had one of these three questionnaires. So the state, trait, anxiety, inventory first of all up here. This measures the state and trait anxiety separately, and it does so on two separate questionnaires that are non-sport specific. So they're quite general questionnaires around anxiety. So we get two measurements on that one. The Sport Competition Anxiety Test, or the SCAT test, which measures, so this is more sport specific, so that's a good thing about that, and it measures trait anxiety and therefore is a good predictor of state anxiety as well, because we know that state anxiety is influenced by trait anxiety. So this does ask 15 sport specific questions. And the CSAI2 version 2 measures cognitive anxiety and somatic anxiety separately, and it also gives a measure of self-confidence as well, so we get three separate measures on that one. So that one's quite good, that we can identify specific areas that might hinder our performance, in other words, whether you're suffering cognitive or somatic anxiety. So that's anxiety. Our key areas are that you know the four types. So quickly jot down the four types of anxiety now. along with one keyword that describes each type. Secondly, add on in terms of cognitive and somatic anxiety when it goes up and down. So what happens during and before a competition. And then we need to know how anxiety is measured. So 3 ways. Name a questionnaire. And hopefully you're able to give advantages and disadvantages of each one. My last point on this is that you need to be able to do anxiety management as well. And that depends on your cognitive and somatic anxiety as to which one you're suffering from. So you need to refer to anxiety management, how we do that, stress management techniques, and that will be covered in a separate screencast. So I advise you to look at that as well, because that could be a question on anxiety. Thanks for listening.